name is Eva Gilia, and the human genetic disease that I chose for my final project is Duchenne muscular dystrophy. So, what is Duchenne muscular dystrophy? Well, also known as DMD, it is a progressive genetic disorder that causes skeletal and heart muscles to weaken over time, affecting movement, breathing, and heart functions. There is currently no known cure for DMD, and patients with this disease commonly only live into their 30s or 40s. The prevalence of this disease, Duchenne muscular dystrophy, is most prevalent in men because it is an X-linked recessive disease affecting about 1 in every 3,600 male infants. It is also important to add DMD is the most common form of muscular dystrophy. Symptoms of DMD include muscle weakness, developmental delays in children, stiff joints, toe walking, frequent falls, difficulty running and jumping, and waddling. Symptoms of DMD commonly appear between the ages of 2 and 4. However, it can be diagnosed earlier if your child starts showing symptoms then. These symptoms will worsen over time as the muscles become weaker and begin to break down more. The mutation of this disease, Duchenne muscular dystrophy, is an X-linked recessive condition caused by a mutation in the dystrophin gene located on the X chromosome. Dystrophin is a protein found in muscle cells that works to keep muscles strong and stable. When DMD is present, little to no dystrophin is produced, which causes the muscles to weaken and break down. This condition affects males most commonly because they only have one X chromosome. So when the mutated gene is present, it will affect, then that'll cause them to have Duchenne muscular dystrophy. Testing for this disease, currently there's a variety of different neurological, physical, and muscle exams that can be performed to determine DMD, including a genetic test which checks for the mutated dystrophin genes, a creatine kinase blood test which measures levels of CK. Higher levels of CK suggest muscle damage, and a muscle biopsy, which is just a muscle sample that checks for DMD related changes. It is important to note that an early diagnosis is crucial for patients with DMD because starting treatments sooner can help manage and slow down the progression of this disease and improve the quality of life for the patient. Treatments. Since there is no cure for Duchenne muscular dystrophy, there are many different treatment options available to help slow down the progression of this disease, including steroid medications. Prednisone and deflazacort are two main steroids that work to maintain heart functions and slow muscle damage. Gene-based therapies, which are just certain medications that produce a shorter form of dystrophin. HDCA inhibitors, heart care, and physical therapy. All of these methods have been proven effective as the life expectancy for DMD has raised. However, patients with this disease still experience a rather poor quality of life, especially as they get older, because their muscles tend to break down even more with age. Current studies, along with the current gene-based therapies being used to treat Duchenne muscular dystrophy, there are many new approaches being tested to hopefully find a cure. In recent years, exon skipping therapy is currently being studied to hopefully lengthen the life expectancy for DMD patients and slow down progression. Skipping therapy essentially is used to make a copy of a specific affected exon and then skip over that faulty gene and produce a shorter but more functional amount of dystrophin proteins. This in return will hopefully slow down the progression of this disease and in return create a higher life expectancy for these patients. The importance of understanding DMD. It is important to understand Duchenne muscular dystrophy to view how it is passed down through a family's pedigree and why men are more affected by this disease. Having a full understanding of Duchenne muscular dystrophy is what will lead to more researchers closer to finding a cure or just lengthening the life expectancy for these patients. Additional information. Even though females are less commonly affected by DMD, there are still some cases where females do experience symptoms. Since DMD is an X-related or X-linked recessive disease, it doesn't affect females since they have two X chromosomes. So even if one of their X chromosomes is affected, the other normal one is still able to produce dystrophin. However, the female is still considered to be a carrier and can pass this disease down to her children. Females who carry, Females who are carriers can still experience symptoms of this disease. Their symptoms will include mild muscle weakness, higher levels of CK, fatigue, etc. Their symptoms are clearly more milder than a male's diagnosis of DMD. However, it is still interesting to see the effects of DMD on a female carrier. This is my works cited page. I hope you guys learned more about Duchenne muscular dystrophy throughout my presentation, and I thank you all for watching.